I've been CMO at the Polyclinic for the last 10 years, and I was on board when Phytel came on board, and in fact was part of the process as we looked at solutions for population health management.
Well, Phytel has absolutely let us unlock the potential of the clinical information that we were busy gathering in patient care and busy storing for coding and documentation reasons, but not able to leverage it anywhere past that.
To achieve the triple aim, right, which is better patient care, lower total cost of care, better patient satisfaction, you really need population health management tools and patient engagement, and you need engaged providers. And a great way to segue into that is through patient outreach, particularly an automated patient outreach solution like Phytel, which really does a lot of the hard work for the physicians, takes a lot of the work off their plate. Many of them do not realize this, but it makes their job a lot easier, and at the same time helps provide better patient care at a very low cost and a great ROI.
You think about a diabetic that's gone over a year without a checkup. That's way too long by any standard, no matter how well controlled your diabetes is. And to be able to draw that patient back into the organization, to interact with the physician, to see truly where their needs are. The ultimate management of chronic disease is interacting with the patient. And if you can't interact with the patient, you're never going to make a difference in their disease. So getting a population back into our clinics, back in front of our physicians and our nurse practitioners and our care managers within the medical homes, drawing them back in when they've been lost basically to the system, was a huge benefit that Phytel offered us.
I think that having Phytel basically being the ability to look for care gaps and the ability to begin to start to coordinate care and to look at high intensity patients gives us a level of confidence that we wouldn't have if we didn't have that ability.
I think you should consider implementing Phytel and adopting it as one of your strategies for population health. It's going to allow you to go from manual processes to automated processes. It's going to allow you to really understand your population, define that population, understand who's at goal, who's not at goal, and it's going to help your staff to do the work in a much more efficient way.
And so the first meeting where I saw Phytel laid out before me, things that I had just dreamed of were on the screen, and it was like jumping from a pedal-powered biplane to a 747.
So within 120 days, we were able to see that we had a 48% of those uncontrolled patients had a drop in their A1C by 1.6 points. So I was stunned. I'm going to talk for everybody else, but I was very impressed about the capability.
Having the Phytel outreach module in place is a key component for us in terms of being able to move down the path towards value-based payments and the assumption of risk. Having the confidence that we can identify those patients, reach out to them in a timely manner to address gaps in care, but also help reduce ER visits, hospital admissions, and readmissions.
The impact of using Phytel Transitions in the emergency room is that I'm able to do more with less. I'm able to contact all of our patients who are treated and released in a very short time period. We call them each 3 times before we stop attempting to get a hold of our patients. And it allows me to save FTEs, save labor dollars.
Extraordinary that they deliver on the analytics and population health quality insight that they promise they deliver on. Fairly extraordinary to work with, very, very positive, passionate people really trying to help us do better for patients every day, which is great to find a technology company that's got that passion for doing better care, because sometimes that doesn't flow to the IT side of our world.
It's gone so much farther. They were already accessing our data. Now we get to see that data ourselves through their new products, through Insight and Coordinate. Not only do we get to essentially work with our own data in a way that makes sense that the EMR couldn't do for us, but then pick away at that data and find out who needs us more and then draw that patient population in. That advancement of Phytel by partnering with its customers has been fantastic and truly innovative.
Phytel has been such a positive experience to work with because the act of getting an analysis company hooked into your HR, getting all the data threads hooked up, connected, and working accurately real time is very intensive. I mean, it took weekly conference calls with IT teams week after week for quite some time to get it really working, but they were enjoyable. The Phytel people were exceptionally responsive. Concerns were, quickly followed up, explored, emails back quickly the next day. So it really was a pretty positive experience, even going through the mechanics of making it hook up, which isn't my area of expertise.
What comes to mind is manual, paper, labor intensive, and with Phytel, it's just now automated. So the word efficiency comes to mind. You just feel like you're better prepared. You're using technology in a way that's useful and meaningful to the patient and really driving their health outcomes. And that's what drives it all. That's what our focus is.
The Phytel solution has addressed the biggest issue, which is getting our clinical data out of an electronic health record in a reporting format where we can then take the next step and do something about it. What it allows provider groups to do is to demonstrate their value, to demonstrate their outcomes and the resources that they use to get to those outcomes and the costs. And in an accountable care environment, providers that can demonstrate good outcomes and reasonable costs to achieve those outcomes will be at an advantage in the market.
Probably the biggest benefit going forward of using any kind of product such as Phytel to look at a population's data is for those of us that are taking risk, those of us that understand a patient population to the point of saying, if we can spend less on that patient every year, we'll benefit. So it's not just a fee-for-service environment anymore, but a risk-based environment for us. And to be successful in a risk-based environment, you need data, and you need data that's actionable. And Phytel gives that to us.
I think that for a regular primary care clinic, there's no way we can achieve the results we've had so far without Phytel.